what is it about, and how and why psychology and naturopathy remedies are needed to manage arthritis. What is the connection? So this is what we are going to see in today's webinar. First,
Okay, ma'am.
Namaste. Namaste, sir. So this is part of the health and wellness initiative by the DAV group. Okay, first let's have a question, which I would request all the participants to answer. So, the question is, does arthritis affect only the elderly? Which means only do old age people get arthritis, or will anyone get? So that is the question. For that, I will share a link in the chat box of the Zoom. You can all go to that link and you can type your answers. Okay. I will also share my screen. So go to menti.com, menti.com, and in that type the code. I will just share you. So you should go to menti.com and use the code 27104219. 27104219. We are getting answers. No. Arthritis affects only the elderly? No. So people say it can affect anybody also. That is probably the question. That is the answer. So, okay. We get yes also. So go to menti.com and type the code 27104219 and answer the question. Does arthritis affect only the elderly? Or do only old people get arthritis or not? Oh yeah, you're getting more of no and less of yes. Okay. Okay. So the results are mixed. Some people think only old age people get arthritis, while some think no, anybody can get arthritis. So we will now go back to our presentation. The answer is, whoever answered as no are correct. Arthritis can affect anybody. Now, what is this arthritis? Before we come to this slide, let us see what is arthritis. Anything that ends with itis in medical terms means inflammation. That is, something is abnormal with that part. Ortho means bone. So itis means inflammation of bone. So that is arthritis. Okay. For example, pancreatitis means inflammation of the pancreas. Uveitis or anything which is ending with itis in medical terminology, which means that organ is affected with some problem, some inflammation. So there is a recent report which says approximately 220,000 children and adolescents had arthritis in these 4 years. When only between 4 years when they took a research, when undertook a research, 220,000 children and adolescents are having arthritis. And among the children who had lot of arthritis was children and adolescents with anxiety, depression, those who were physically inactive, who did not move much, who were overweight or had a heart problem, or lived in a food insecure, wherein they don't get proper 3 meals a day, or in a smoking household. Among adults aged 18 to 45 years, the next set, 5% have arthritis. 45 to 65, 26%. Above 65, nearly 50%, means among adults above 65, half of them have arthritis. If in this webinar, we're going to have 10 participants. If those 10 participants are above 65, then 5 will have arthritis. Such is the prevalence of arthritis. It's a very, very serious condition, because we may think, okay, knee problem only, no? What is going to happen? So first, before we come to this slide, there is one more question I would like you all to answer. So go to that menti.com website again. Go to menti.com and answer this question for me. The question is, what are the symptoms of arthritis? By knee pain or joint pain, other than pain, do you have any other symptom, or pain is the only symptom? Please go to menti.com, which is in the chat box. Neha ma'am or Shanmugapriya ma'am, can you please type that again for people?
Yes, ma'am. Yes, ma'am.
Yes. So you can enter anything. Whatever is the problem you have when people say they have arthritis or knee pain. Okay, we have joint pains, swelling, not able to move. Okay. Then what else can we have? So go to menti.com and use the code 27104219. So we have pain, joint pains, knee pain, swelling, stiffness. Very good. We have stiffness, difficulties in walking, knee pain. Okay. So now these are the main problems, right? But why am I saying that osteoarthritis is going to be a big problem? Okay, let people have knee pain. Can someone unmute and tell me what is the biggest problem? Why would knee pain affect anybody? Can someone tell that, please? Can someone unmute and tell, please?
Can you repeat the question, please?
Yeah. Okay, knee pain is there. It's fine. But what is going to happen? Why is it a big problem? How is it going to affect a life of a person? Or what is the big thing in it? Can someone unmute and tell?
The basic locomotion gets affected, walking.
Okay. So what happens? If walking is affected, what happens, ma'am? What happens to the life of the person?
They are dependent on other people even for the most basic needs.
Okay, good. Anybody else can tell what happens? Why is osteoarthritis or knee pain or hip pain a big problem in the elderly or anybody for any age, even youngsters? We have, okay, there are some answers to the obesity, no exercise. Okay, that's nice. Arlen. So for people from Chennai who have joined, முட்டு வலி இல்ல இடுப்பு வலி இருக்கிறதால என்ன ப்ராப்ளம் இருக்கு, அதனால என்ன ஆக போகுது, லைஃப் எப்படி அஃபெக்ட் ஆகுது? Can someone unmute and tell? யாராவது unmute பண்ணி சொல்ல முடியுமா? People who have joined now, we are asking a question. Knee pain, hip pain, how does it affect the life of an individual? Can someone unmute and tell? Or even type in the chat box. You can also unmute. Unmute பண்ணி சொல்லலாம் இல்ல type பண்ணலாம். What's going to happen? Hip problem, knee problem, with knee problem and hip problem.
Good evening.
Yes. Yes, ma'am. Yes, please tell, ma'am.
It may even affect their heart if the mobility is reduced.
Yes, correct. That's a correct answer. Okay, knee problem is there. How does it affect the daily living of an individual?
Even visiting the restroom, sitting, squatting, everything, it becomes very difficult.
Yes, 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 yes. We have a chat also. It prevents going to work. Yes, exactly. When youngsters are going to get, and as ma'am says, even the basic things like going to a restroom, it is so difficult to walk to the restroom with severe knee pain and hip pain. And there are many people from youngsters to elders who are, in the urgency, when they have an urgency to urinate, they may even pass urine on their dress. So that is the magnitude of the problem. So this prevalence is so alarming because it affects sleep. Pain can affect sleep. When you have severe pain, your sleep quality will decrease. It will affect mood. Imagine having, there will be so many people here who might have mild arthritis or mild pain or some injury to the knee. We would all have experienced sometime in life, right? That itself will affect our mood so badly. The pain is so bad that it affects you. It makes you become dull. It prevents you from participating in daily activities like walking, running, going to work, or whatever work you are doing. And absent to work has cost 10 billion US dollars to the world because of osteoarthritis. Total cost per year is 136 billion. And per year cost is 11,000 billion. Indirect cost is 17 billion. So these are all real life, prevalence and real life statistics. So it is the third most rapidly rising condition associated with disability behind diabetes and dementia. So you can imagine so many people are affected with osteoarthritis. As somebody rightly pointed out, it will affect the heart also because it is also a comorbidity with conditions like diabetes and hypertension. When all of these are put together, because you have osteoarthritis or arthritis, your walking gets lowered, you walk less, so your obesity increases, which also affects the heart. So the third of people with osteoarthritis will have 5 more other chronic conditions. This itself is a problem. 5 more chronic conditions, and it increases the risk of developing heart disease by 50%. So a person with arthritis, if they do not manage the condition properly, it increases the risk of developing heart disease by 50%. Now, what is this arthritis? What's happening in our body? So there are joints in our body. Joint means any structure that separates or connects two bones. That separates or connects two bones. Okay, so there are these joints. There is a joint in your neck called atlas and axis. Shoulder joint is there. In your hand, there is this radioulnar joint. And there are hip joint. There are, joints in the knee joint and the hip joint are the major joints which are affected by arthritis because of the weight-bearing nature. Weight-bearing nature means, see, the body's legs only bear the weight of an individual. So that is why when you are diagnosed with arthritis, doctors say, please reduce your weight. It is not because that there are other problems of obesity also, but these joints are called weight-bearing joints. So when we have more weight put on them, then the degradation is more. Okay. So what is arthritis? Arthritis, anytime you listen to the word, it means joint is inflamed. Any joint, whichever joint you have pain, that joint is inflamed. There are different types of arthritis. It's not only osteoarthritis. We'll come to this. So, okay, whenever somebody says knee pain, joint pain, we should not immediately jump to the conclusion that it should be only arthritis. Arthritis is inflammation of the joint, but in common terms, osteoarthritis, which means degeneration of the bone with age. As you grow old, the bones start to degrade. Because of that, when the joint is affected, it is called osteoarthritis. But it also occurs in younger people wherein due to sports injury or when they are obese or when they have depression, when they have chronic stress, when their movement is not proper, posture is not proper, then also the cartilage may get affected. And that type of cartilage degeneration associated joint pain is called osteoarthritis. So when somebody says arthritis to you, you should immediately ask them a question. What type of arthritis do you have? knee pain சொல்றீங்களே உங்களுக்கு என்ன type of arthritis சொல்லிருக்காங்க? Because the treatment varies according to the type of arthritis. For osteoarthritis, we will see how it happens. The cartilage is degraded. It is gone. So two bones are direct contact with each other. The material which is preventing the friction, that is gone. So that is why pain occurs whenever they move. In rheumatoid arthritis, it is not only the degradation of the bone, but there is an autoimmune component. There are antibodies produced in the patient's body against the own joint cells. That is why it results in rheumatoid arthritis. So for osteoarthritis, only for pain relief, they will give steroid, that too for severe pain. But for rheumatoid arthritis, to destroy the antibodies, steroids are the main line of treatment. So that is why the type of arthritis, the patient should be aware to know what is the correct treatment. There are 180 types of arthritis actually, but let's not go into all that. These are the four major kinds. The next is psoriatic arthritis. What is psoriasis? Can somebody tell what is psoriasis? I'm giving a kind of a clue also to everybody. What is psoriasis?
Itching.
Yeah, I was itching, but what? Okay. So it causes itching. Yes, it's kind of a skin problem. So psoriasis is actually a skin problem. Okay. It's an autoimmune skin problem wherein, like rheumatoid arthritis, antibodies are produced against your skin cells. So skin becomes scaly, like patch, it will become whitish. Because of that, there are antibodies produced against the heart and joints also. So because of psoriasis, there will be psoriatic arthritis and gout. Gout means increased uric acid in the body, which is either due to their food habits or due to genetic causes. Okay. So because of that, they may have joint pain. So whenever somebody has joint pain, it is very important to take the lab test and X-ray to find out. See, X-ray will tell you that bone is degraded, but you should take the laboratory test to find out what type of arthritis it is to treat properly. So this is the major example. That is major difference. Sorry. In osteoarthritis means it is degenerative. The cartilage is gone. That is why the bones are in touch with each other and pain is coming. Rheumatoid arthritis is autoimmune. So how do I find the difference, ma'am? I have not gone to a doctor, but I have symptoms. So how can you find the differences? Usually, osteoarthritis will be in the weight-bearing joints. As I said, hip, knee, lower back, neck, because it bears the weight of the skull, the head. So these joints will be affected mostly. But rheumatoid arthritis will mostly can appear in any joint, especially the non-weight bearing joints also. So if they have stiffness and joint pain in the hands and wrist, they should think about rheumatoid arthritis and check with the doctor. So with the osteoarthritis, it happens in the weight bearing joints. Rheumatoid arthritis can happen in any joint. And osteoarthritis will be mild in the morning because as we move only, the joint is used more because of the cartilage is degenerated. Bone to bone, there will be friction and pain will increase. But rheumatoid arthritis is due to inherent autoimmune problem. So it will be worse in the morning. So the moment a patient says knee pain or joint pain, you should ask the question, does the pain increase in the morning after you wake up or during the day? If they say morning, immediately they should consult a doctor for rheumatoid arthritis. So telling it in Tamil, முட்டுவலி, knee pain, இல்ல hip pain, இல்ல எந்த hand, wrist pain ன்னா அவங்க கிட்ட question கேட்கணும். காலையில எந்திரிச்சோனே வலி ஜாஸ்தியா இருந்ததுன்னா அது ருமட்டாய்டு ஆர்த்ரைட்டிஸா இருக்கதான் வாய்ப்பு அதிகம். டே ஆக ஆக அந்த வலி த்ரூ த டே வலி அதிகமாச்சுன்னா மூமெண்டால அதிகமா இருந்தாலும் அது பேர் ஆஸ்டியோ ஆர்த்ரைட்டிஸ். But joint pain, stiffness, everything will be same with osteo and rheumatoid. For rheumatoid arthritis, they may get fever and loss of appetite. Treatment is here weight loss, surgery and exercise. But for rheumatoid arthritis, they may not advise surgery because even if they are getting surgically operated, unless the autoimmune problem is corrected, again and again the joint will be affected. That is why we are saying whenever they say knee pain or joint pain or any joint pain, don't immediately come to the conclusion that it needs to be osteoarthritis. It can be rheumatoid arthritis also. So this is normal joint. Here, this is the cartilage. See how big it is. When it gets smaller, thinner or lost, then the bones have to rub against each other and that is why you get pain in osteoarthritis. In rheumatoid arthritis, that cartilage remains the same, but it becomes abnormal. It is because there are autoantibodies formed, there is swelling on that area, and that is why there is bone erosion itself. Okay, so this is it. Now we're going to watch a video.
Osteoarthritis is the most common form of arthritis.
I'll just share with the sound again. 1 minute. I will show you. I wanted to show you like, yeah. I am just sharing screen also. Yes. Okay, now I'm going to play.
and affects millions
Is
of
the sound
individuals.
of the video audible?
It is classified as mild, moderate to severe.
Yes,
It
ma'am.
affects
Yes, ma'am.
many parts of the body, including the knee. The knee joint is
This
made
is
up
the
of the
knee
femur,
joint.
tibia, patella, a loin.
This white color thing is the cartilage that will protect the bone
The end of the
ends.
femur is covered in articular cartilage, which moves against the
When
articular
bone
cartilage
moves
of the
like this
tibia.
only, the cartilage will move for smooth movement.
In a healthy
okay?
knee, the articular
a
cartilage
healthy
is
knee.
time. Osteoarthritis affects the bone, cartilage, tear,
So
and increased
this is a mild osteoarthritis. You can see this red damaged portions, no, in the cartilage. So what, and also these bone ends, no, because of the inflammation, they will form spurs. You would have heard doctors telling in the X-ray that you've got a spur in the knee bone. So what happens is whenever this damaged portion comes in contact during movement, then they will have pain.
degrading enzymes. In addition, bone spurs,
So
known
this
as
is mild
osteophytes, may begin to
osteoarthritis.
develop. Disease may be slowed at this stage
In
by
this,
increased exercise
increased
and weight
exercise
loss.
and weight loss. Actually, see, in this, they are actually recommending increased exercise because when you are improving, when you are sedentary, because of that, obesity will increase, weight will increase, more problem to the joints. That is why in mild osteoarthritis, exercise is advised and weight loss is advised. But when you go to moderate
With
OA,
moderate knee
see
OA,
how bad it is
changes in the
becoming.
joint are much more evident.
Much more
The cartilage surface
worsened.
between the bones has begun to erode. Fluid lubricate the joint is now becoming less viscous, elastic, and concentrated. Osteoarthritis often affects the subchondral bone,
So when it's become
located
moderate
just
osteoarthritis,
underneath the
underlying
cartilage.
bone also gets affected.
Subchondral bone provides hydration and oxygen to the cartilage. As subchondral bone flattens and tries to repair itself, cytokines and proteins
there
are
are
released
proteins
into the
called- there
synovial
are,
fluid.
proteins which are inflammatory, which worsens the joint problem. They are all released into the body. So that happens when moderate osteoarthritis
Long
happens.
lasting, both with movement and at rest.
So it becomes worsened. Okay. That time they'll give pain relief medications and other cartilage strengthening medications, weight loss, exercise, and steroid injections,
pain relief,
hyaluronic
HA,
acid,
or steroid
the
injections
extracellular
are
matrix
commonly
building
prescribed
proteins.
treatments. With severe
This
OA,
is severe
conditions
OA.
worsen
Imagine your
dramatically.
joint, no,
The
how
joint space
bad
has
it has
become
become
far
because they have
narrower,
neglected
causing
it.
more rapid and
it
severe
got
destruction of the cartilage.
Degraded.
Knee becomes inflamed and sore.
In this case,
Synovial fluid
whatever
is
we do
decreased,
will not help.
increasing friction and pain during movement. Within this,
So how pitiable, no? This knee joint is, undertaking so much problems because of us. Yes. So what happens is, so what I would want to tell you is, what are the risk factors? So in women, because in women after menopause, the calcium levels in the bones get decreased. So for them, osteoarthritis, that is why knee problems are more common in women after menopause than men. Okay, and bone deformities, if they have from any other bone deformity, osteoarthritis can happen. Joint injury, when they are under any sports or any trauma, any accident happen, that can lead to. Obesity is one of the key factors of people getting knee problems at a younger age. And when there is increased iron in the blood, so that may also lead to osteoarthritis. And family history of osteoarthritis. If the father or the grandfather, the grandmother had, then the risk is high. And diabetes, because the sugar which is not broken down and taken by the cells will lead to abnormal products being secreted into the cells, which will increase the inflammation in every organ. Once we have diabetes, every organ will get affected: kidney, bone, heart, everything. Okay. And sports and jobs, and women are more likely to have osteoarthritis. But in rheumatoid arthritis, it is due to the immune system. What happens is, when there is throat infection due to streptococcus or fever at some points in life, the immune cells which are produced by the body against this infection actually gets confused and turns against the own body joint cells. So that is why it could be related to obesity, but it's more to do with other factors, especially stress. Rheumatoid arthritis and any arthritis for that matter is worsened by stress. That is why we are having today's session where we are telling you why psychology is very important. And environmental factors, the diet which you eat is very, very important. You should avoid inflammatory diet, about which Dr. Amuda will be speaking, and about mindfulness, Nega ma'am will be speaking. And diagnosing, they take X-ray and blood test. Because why, ma'am? We already explained, with X-ray alone, you cannot diagnose arthritis. You will need blood test, because you will have to find out whether it is osteoarthritis or rheumatoid arthritis when the doctor is having a doubt, because hand, wrist and all is affected. Okay, not always. If it's going to be only one joint affected, only one side knee joint, because when it is going to be osteoarthritis, usually it will affect both the joints, right? Because it is both are getting equally damaged. But only one joint means they will do joint fluid analysis also. Then finally they take MRI. So there are first education, exercise and weight control, which is the first thing anybody would suggest. That is why we are having today's session. But if you are not able to control it, you saw the video, no? At mild OA itself, you are able to do something and save your joint, it will be very thankful to you. Nothing can replace the natural joint. Even if we do surgery, it is a metal prosthesis which will be placed, not your normal natural joint. So whatever God has given you, it's your duty to protect it. Then they will give you pain relief, pharmacological pain relief, physiotherapy, by which they'll help to relieve the bones and the friction. Finally, the second and third line of treatment is surgery for osteoarthritis. Why weight loss? As I said, there will be less inflammation, because fat, when it gets deposited, fat is a very bad person. Always remember, fat is not just gaining weight. Fat will increase the inflammation in the body, and sleep will be affected. And then that is why when you have maintain a healthy weight, then you can also have good sleep, better health, and prevents delays progression of osteoarthritis. What is this knee replacement, ma'am? What is the surgery they do? So they take off this bone which is affected. Sorry, they take off the cartilage which is affected, and they put a metal covering to the bones. It will be partial knee replacement. Only one part of the cartilage is affected. That part alone they will replace. Or full knee replacement, like both cartilage and underside also. This part also into the tibia also, they'll place a metal process. Complete processes they will do. Hip replacement is similar. They're going to keep a metal joint which will work as your natural joint. But always remember, see, this surgery is for people who have severe pain, severe osteoarthritis, where nothing can be done. Whatever medication you give, nothing is going to work. So to prevent progression to this only. And for rheumatoid arthritis, as I said, it is not surgery, it is but steroids and disease modifying agents, biologics are used. So you should be very aware. So don't go to the level of surgery. And there is another important reason for why we are having today's session. In arthritis, research has proven that perception of pain, how you perceive the pain and what influences the pain, is more important in the progression of osteoarthritis. For example, if I am having osteoarthritis, if I am having a degraded cartilage joint, okay, I am not, I am obese, but the obesity is related to more to my stress. Okay. Now what is going to happen is, because of weight gain, I will have frustration, I will have increased stress. And again, fat and obesity prevents you from sleeping. Then we become less active, persistent pain. We are due to the pain, we are unable to spend time with the family. And if there is going to be other financial constraints, the pain is more. Anxiety and depression will cause the pain to be more. But in the other hand, if you are able to manage pain and also take the home remedies with psychological and naturopathy remedies, then you can manage osteoarthritis and you can prevent it from progressing. That is why we are having today's holistic session. And another important point is, there is something called gut-bone axis, stomach-bone axis. Imagine, what you eat affects your bone also, because immune system is involved. That is why exercise, good food which has probiotic like curd, yogurt, idli, pickles, and diets and supplements will help you have a good bacteria in your stomach, which in turn will make you manage a good joint. So that is why we are having the naturopathy remedies by Dr. Amuda and the mindfulness, because osteoarthritis can be managed in a good way if you are finding it at an early stage and following all these remedies. Now over to Dr. Amuda. Amuda ma'am?
Yes, ma'am. Yeah. Am I audible?
Yes, yes.
Am I
Yes,
visible?
yes, you are. Ma'am,
Okay.
you are.
I'll just share my screen. Just one moment. Is my screen visible?
Yes, ma'am.
Okay. So namaste and good evening to all. Thank you, Preeti ma'am, for that wonderful introduction on arthritis and the other remedies which they do and all. So now that we have been sitting and listening for the past half an hour to 40 minutes, I would request like all of us to, maybe just move our joints a little, just exercise the joints, just for a few seconds or so. So I request all the participants to maybe switch on their videos and just, just follow whatever I'm doing. Yeah, that would be really great. Just one moment. Yeah. Am I visible now?
Yes, ma'am. You can probably stop the screen sharing so that we all participants, you can see us doing it, whatever you are asking us to do. Yes.
Yeah.
Yes.
Yeah. All right. Okay. Now, can I see both your hands out like this? Your fingers, all your 10 fingers? Yes. Okay. Now, just bend your fingers nicely. Make them into a nice fist. Very good. Now, spread them out. Expand nicely. Bend. Open. Now, bend again. Now, rotate. Rotate. Up. Now, hands on your shoulders. Yes. Now, rotate your shoulders nicely. Give yourself a nice stretch. Opposite direction. All right. That was great. Thank you so much. So I'll just start with my presentation. Here.
Sure, ma'am.
Okay. So I'll be talking about how to manage arthritis the most natural way possible. Yes. So that is what naturopathy is all about. Yes. So moving on. Sorry, I think there's a issue with my video. Ma'am, can I just
Okay,
rejoin once again? I think there's a problem with my video.
Sure, ma'am. Sure.
Yeah, I'm so sorry. Just 1 minute. Yeah.
No problem. Yes. So till ma'am
So
joins.
by the time ma'am joins in,
yes.
can all the participants once, can we have a good round of clap? என்ன சொல்றீங்க எல்லாரும்? ரொம்ப சிம்பிளா clap பண்ணலாம். Okay. So this is called as raindrop clap. Okay. What we are going to do is first one finger which we are going to do it. Then 2 fingers. Then 3 fingers. Then 4. And then 5. எல்லாரும் பண்றீங்களா? எல்லாரும் unmute பண்ணி பண்றீங்களா? Will everyone unmute and do it? Okay, all of you kindly unmute. You may not switch on your videos if you are uncomfortable. Okay, we'll start first with 1 finger, 2 fingers, 3 fingers, 4 fingers, and 5 fingers. Can we do it once again? Okay, clapping hands is very good for our health. So let's do it once again. 1 finger, 2 fingers, 3 fingers, 4 fingers, and 5 fingers. This is called as raindrop claps. And people from Chennai, as it is raining in some parts of Chennai, you can see that when it rains, it slowly increases the sound. It's first a very small sound, then the sound goes on increasing. So just to celebrate the rainy season, unannounced rainy season in Chennai, and also to, what do we say? Bring in the practice of clapping, because when you clap, the main acupressure points in your hands, they get pressed. And if you remember, in the olden days, in the evening and all, they used to have something called as aarti. In Indian culture, it's very common that they will have aarti. At that time, they all will clap their hands and they'll go to the temple, they'll do the aarti, they'll clap their hands. And at that time, all the main pressure points, the chakra points will get pressed, because of which they had a better health and life. So whenever possible, even if you're sitting alone, clap your hands. It will increase you and have a good life. So we'll wait for Dr. Amuda. Till then, Dr. Preeti, you want to add something?
Yes, what I wanted to add is the knee pain is usually more worsened in cold climates and cold conditions. So summerல இருக்கிறத விட winterல usually knee pain அதிகமா இருக்கும். So in the home remedies, in the mindfulness, in the psychology techniques, இவங்க இன்னைக்கு என்னெல்லாம் சொல்லி தராங்களோ அதை வந்து நிறைய பெயின், நமக்கு வந்து ஸ்ட்ரெஸ் ஜாஸ்தி இருக்கும் போது, அந்த கோல்டு கிளைமேட் இருக்கும் போது, அந்த என்விரான்மெண்ட் மோசமா இருக்கும் போது தான் ஞாபகப்படுத்தி இன்னும் ஜாஸ்தி we have to do. So we should remember these techniques which they are telling today for managing knee pain and osteoarthritis when we are more stressed, when the environment is not conducive, when the weather is not fine. That is what I wanted to add, ma'am. So as probably as Amuda ma'am is joining, you can start with your few of your slides.
Okay,
Neha.
I will. Yeah.
Yes.
So namaste all. My name is Neha Bhardwaj, and I'm a psychological counselor. So we would be now talking about the arthritis and how psychology plays an important role with arthritis. Okay, so let me share my screen. Yeah, just a minute. Okay, so is my screen visible to all?
Yes, ma'am.
Cool. So let me put it on a full screen mode. Okay, so psychology and mindfulness for managing arthritis. So if I speak about arthritis, then why are we talking about psychology and mindfulness as a question? Medicine pati dane pesano. Why are we talking about mind here? Because mental health plays an important role in arthritis. Maybe genetically we might have arthritis because our parents had it, or our mothers or our grandparents have it. So there is a chance we might have arthritis. But at which age it begins? That is onset. In the vayasula arthritis begin arthu. That is totally dependent upon our lifestyle, and it is also dependent upon our stress, anxiety, and depression. That is psychological factors. Similarly, how do we manage it? Seri, psychology படிச்சனுக்கு என்ன arthritis சரியாயிடுமா என்ன ma'am அப்படின்னு கேக்குறதுக்கு we don't know. Psychology will not help you cure arthritis per se, but it will help you cure the management. That is, it will help you manage the pain. When does the pain come? How do you deal with the pain? All those things it will help you deal with. Similarly, Preeti ma'am, can you, I'm not able to see the third point in my slide. Can you just help me see it?
Yeah.
Can you just tell me what it is?
Onset, progression, and management. Yes, ma'am.
Thank you. So, talking about progression, at which, like, in the stage, arthritis வந்து faster grow ஆகுது. That is, in this stage, it is going to run. That is the okay, like ma'am said, you have mild arthritis, you have moderate arthritis, and you have severe arthritis. So எப்படி progress பண்ணறது is also dependent on psychology. So if you have mild arthritis, then progression to moderate and to severe can be managed. The space can, in the speed la adu munadi poradho, the pace, it can be reduced if a few psychological techniques are followed by us. So onset, in the vascular vardu, progression, how it is going to progress, which stage it is, how fast it will go, and how to manage. Yes, medicines will cure arthritis, may or may not cure arthritis, but psychology will help you manage the pain. And that is why we are talking about psychology in arthritis. Okay. So first is stress. Let's talk about how stress, anxiety, and depression, they affect our arthritis. Okay. So we have pain. When we have stress triggers certain hormones such as cortisol. பாடியில ஒரு ஹார்மோன் இருக்கு கார்டிசால். அது வந்து ஸ்ட்ரெஸ் ஆகும்போது ரிலீஸ் ஆகுது. அந்த மாதிரி நிறைய ஹார்மோன்ஸ் இருக்கு. Many hormones are there which are triggered when we have stress, okay, which affects the immune system. Okay, and when the immune system is affected, joints get inflamed. ரொம்ப சிம்பிள். நீங்க ஸ்ட்ரெஸ் எடுத்துக்கிறீங்களா, ஸ்ட்ரெஸ் ஆனாக்க நிறைய ஹார்மோன்ஸ் நம்ம பாடியில ரிலீஸ் ஆகும். இதுல இருந்து ஒரு ஹார்மோன் இஸ் கார்டிசால். இந்த மாதிரி பல ஹார்மோன்ஸ் சேர்ந்து நம்ம இம்யூன் சிஸ்டம், okay, in Hindi it is called as Rog Pratikarak Shakti. In Tamil it is called as I think immune system na to fight our diseases. Okay, adu fight pandra the system that will get affected. If that gets affected, there will be inflammation in joints which will give you more pain. So when hormones, stress hormones are released, the pain will be high. So if you have stress, anxiety, or depression, and like ma'am said, stress, especially anxiety and depression, irundha arthritis la unnu adhigama pain feel agum. In arthritis, there will be more amount of severe arthritis if you have anxiety and depression. So what increases stress, depression, and anxiety? எதனால arthritisல stress, depression, and anxiety அதிகம் ஆகுது? First is negative coping strategies such as catastrophizing. அப்படின்னா, okay, உங்கள்ல இருந்து எவ்வளவு பேரோட இது ஆறுதுன்னு எனக்கு கொஞ்சம் யோசிச்சு சொல்லுங்க. உட்கார்ந்து இருக்கீங்க, உட்கார்ந்துட்டே ஒரு thought வருது. One thought comes to your mind, and then you start building on the thought and you go to the most negative outcome. Like, okay, இன்னைக்கு என் பையன் எக்ஸாம் எழுதியிருக்கான். Today my son has given his exam. Now, what will be his result? Will the paper be tough? What if what he studied did not come? What if he fails? What if he sits in the same class? What if he repeats a grade? Then will he ever get a job? Then will he ever get married? Then will he ever have children? Will he have a fruitful life? That is catastrophizing. This also happens with arthritis. When we are suffering from arthritis, we tend to go to the most negative outcome. Oh, I have pain. Will this be arthritis? Oh, now I have arthritis. Now I'm not able to walk. Now I'll become dependent on other people. I'll get bedridden and my life will go away in bed. All the negative things. That is thinking about the catastrophe. So if you have the habit of catastrophizing, there's a chance you will get arthritis. And if you have arthritis and you are doing catastrophizing, then your pain will be much more severe and your symptoms will be much more severe. Avoidance. When we start avoiding certain things or certain situations with the fear that it will become true, then also we can get arthritis at an earlier stage of life, or we can start, if we have arthritis and if we are having avoidance, then it will go to the severe form of arthritis. Okay, so if we just think, உங்களுக்கு இந்த negative coping strategies இருக்கா? Do you do these things? Just think for a moment. Next, arthritis இருக்கும்போது daily பண்ற சின்ன சின்ன வேலை கூட ரொம்ப பெரிய சிரமமா தெரியும். Daily activities will become very difficult, right? Inability to work, even the inability to do even our most basic things like getting up itself will be a big challenge. Bedல we are sleeping. We need to get up and keep our foot on the floor and it starts paining. Daily activities become very difficult, and this leads to frustration, irritation, anger. And once we have frustration, irritation, anger, again, stress will go into our body. Stress hormones will start piling up, and then all the inflammation will be more, all the pain will be more. And our immune system will get affected, because of which we will have other related diseases which are called as comorbidities. We'll start getting fever frequently, we'll start getting cold, we'll start getting allergies. So anger, irritation, fatigue will increase the arthritis or the onset and the progression of arthritis. Next is self-downing and unacceptance of self. Now, arthritis is a big change in life. We were very mobile. நம்ம எல்லா வேலையும் தானே பண்ணிட்டு இருந்தோம். Suddenly this arthritis came in, and now we find doing our most basic work such as brushing, getting up from the bed, going to the toilet, sitting in the toilet seat, everything becomes difficult. In the மாதிரி situationல we tend to pull ourselves down by stating, எப்படி இருந்தேனா, how much work I used to do, எல்லா வீட்டு வேலையும் தானே பண்ணிடுவேன், நான்லாம் ஆபீஸ்ல போய் எல்லா வேலையும் முடிச்சிட்டு வந்துடுவேன் தெரியுமா, I'll finish up all the work in the office even before my boss would tell. We would always compare ourselves to the healthy self, and then we'll start hating this self of ours. After getting arthritis, the life change that has come will make us hate us. We'll constantly put ourselves down. Idu kudaya panna mudla. I'm not even able to do this. I'm not even able to do this basic thing. And we are not able to accept our own self, which leads to further problems. And social acceptance. We ourselves start avoiding going in the society. We avoid our relatives, we avoid our friends, because we don't want to show them the self of ours. நம்ம இப்ப எப்படி இருக்குமோ அந்த மாதிரி நம்மளுக்கு நம்ம ஃப்ரெண்ட்ஸோ ரிலேட்டிவ்ஸ் எதுக்கும் போக வேண்டாம். So we start going into a self-isolation mode. நம்ம என்ன பண்ணுவோம், இல்ல போனானக்கா அவ என்னை பத்தி என்ன நினைப்பா, அவ என்னை எப்படி ராஜாட்ட பார்த்திருக்கா, how they have seen me like a king, and now will they accept me like this? Thinking that we start avoiding marriages, we start avoiding social functions, any social occasion, we start avoiding and we become self-isolated. Similarly, societal isolation. This happens if there are people in this webinar who are relatives of people who are suffering from arthritis. We as a family unknowingly start isolating our family members who are having arthritis. We are like, no, please do it. Please don't do it. Your leg will pain. No, don't do it. Your hip will pain. Don't do it. Your hands will pain. No, you don't come outside. You will get all the cold, cough, everything. Your body will start aching. No, we cannot take you anywhere. We actually are thinking good for them. We are like, no, your the family member should not get any problem. But unknowingly, we are isolating them. And we are actually further putting them down. Rather, whatever they can do, let them do with their willpower. That will actually help them fight arthritis. And people who are having arthritis, your willpower will help you fight it. Whatever you can do. I'll be sharing a story with you. At that time, maybe you will be able to correlate better. So, arthritis leads to anxiety, depression, and stress, which further contributes to arthritis. So if you have anxiety, depression, stress, and you have a history of arthritis in your family, there is a chance that you can get arthritis early. There is a chance that you can progress to different stages of arthritis fast. Okay, and management of arthritis will become difficult for you. And if you have arthritis, there is a high tendency, that is, like ma'am said, close to 20% to 40% of people having arthritis have anxiety, depression, and stress. And it will make arthritis further worse. So arthritis irukna anxiety, depression, stress irukum. Adanalu unnu arthritis worse agum. Anxiety, depression, stress irundaduna arthritis seekrama vara chance irukku. சீக்கிரமா சீவியர் லெவலுக்கு போற சான்ஸ் இருக்கு. Okay. Now, what is the effect of arthritis? So first is, because of arthritis, we போன ஸ்லைட்ல சொன்ன மாதிரி we go into a social isolation, right? Either society isolates us, our family isolates us, or we ourselves isolate ourselves. Okay, which leads to anxiety, depression. Okay, because of which further, that is lack of movements, further movements are stopped, right? We say ஐயோ எனக்கு arthritis இருக்கு, என்னால வேலை பண்ண முடியாது. Or our family says ஐயோ உங்களுக்கு arthritis இருக்கு, நீங்களா போய் கிச்சன்ல சமைக்காதீங்க, ஐயோ வெளில எல்லாம் வாக் போகாதீங்க, பாடி பெயின் வரும். This will lead to we not doing much activities, not much movement of our hands, our legs, which will further amplify arthritis. So it's actually our thoughts which will amplify the arthritis. So if someone is doing this to you, or you are doing it to yourself, just keep a check. If you are going in for a social isolation, you say it's okay. நான் எப்படி இருக்கேனோ நான் பெஸ்டா இருக்கேன். நான் arthritis choose பண்ணேன். Did I choose that I should get arthritis? Did I wish that I should get arthritis? If I did not do these things, then why should I stop myself from living? If it has come, let it come. I'll live the way I am. I'll try my level best to live. Okay? Tell yourself and keep movements. Don't go in for social isolation. If you do this, even if you have arthritis, you will not progress to severe level of arthritis. You might be able to lead a life with mild and moderate arthritis. Now let us come to perception. Some time back, Dr. Preeti spoke about pain perception, right? So let us talk about pain perception from psychological angle. Can someone tell me what is perception? Perception na enna?
நம்மளா நினைச்சுக்கிறது மேம்.
நம்மளா நினைச்சுக்கிறது, right? Manju ma'am, thank you very much, right? இன்னும் யாருக்காவது someone can say something? What is perception? Chat box ல கூட நீங்க டைப் பண்ணலாம். What is perception? Yes, யாராவது சொல்ல முடியுமா? Anuradha ma'am.
Our way of looking at things in the chat box. We have received one answer.
Oh, okay. Yes, thank you, Hemamalini ma'am. Our way of looking at things, perfect. So Manju ma'am, Hemamalini ma'am, you are very right. The way we look at things, நம்ம எப்படி லைஃப பார்க்கறோம், எப்படி ஒரு சின்ன சிச்சுவேஷனை பார்க்கறோம் is called as perception. Perception can be this is 6 or this is 9. This is a very common example given for perception, right? It is 6 it is 9. Am I right? So how we look at things matter. Now, the pain cycle is somewhat related to the perception of pain. So pain cycle is, you might have, okay, இப்படி imagine பண்ணுங்க, ஒரு bullock cart பார்த்திருக்கீங்கல்ல, மாட்டு வண்டி. You have seen a bullock cart, it has 2 wheels. Okay, so one wheel is the physical pain, the other wheel is the psychological pain. Based on this, supported by this is your bullock cart of pain. Pain or bullock cart வந்து physical pain and psychological pain ஓட basisல நடந்துட்டு இருக்கு. Okay, it is going ahead based on that. Now, bullock cart be able to move. இப்போ bullock cartக்கு 2 wheel இருக்குல்ல, அதுல இந்த ஒரு wheel stop பண்ணி எடுத்து மூவ் பண்றதுன்னா அந்த bullock cart முன்னாடி போக முடியுமா? போக முடியாது, right? So physical pain இருக்கு, psychological pain இருக்கு. ஏதான ஒரு பெயினை நீங்க ஸ்டாப் பண்ணீங்கன்னா அந்த bullock cart of pain cannot move ahead. Physical pain நீங்க மருந்து மாத்திரை வச்சுதான் ஸ்டாப் பண்ண முடியும். ஆனா psychological pain நீங்க தானே கண்ட்ரோல் பண்ண முடியும். You have to distract yourself from the pain. சின்ன வயசுல பாப்பாலாம் விழுந்ததுன்னா நம்ம என்ன பண்ணுவோம்? நம்ம வந்து பாப்பாக்கு அச்சோ ஒண்ணும் இல்ல உனக்கு பட்டுடுத்தடா ராஜா, ஐயோ பாவண்டா கண்ணா, என்னோட செல்லமே, என்னோட குட்டின்னு சொல்லி நம்ம என்ன பண்ணுவோம்? அந்த நம்ம வந்து இந்த ஃப்ளோர் அடிச்சுடலாம். ஃப்ளோர், ஏன் நீ பாப்பாவை அடிச்ச? Why did you hit my child? அந்த மாதிரி சொன்னோம்னா இந்த பாப்பா அழுது நிறுத்திடும். இமீடியட்லி நம்ம ஒரு டாய் கொடுத்தானா அது மறந்தே போயிடும் அதுக்கு வலி இருந்தது. Am I right? அதே மாதிரிதான் நீங்களும் உங்க பிரெயினை உங்க மைண்ட டிஸ்ட்ராக்ட் பண்ணும். எப்படி பாப்பாக்கு ஒரு பட்டானக்க நம்ம ஒரு சாக்லேட் கொடுத்துட்டோம்னா ஒரு டாய் கொடுத்துட்டோம்னா அது அந்த பெயினை மறந்து போயிடுதோ, அந்த மாதிரி உங்களுக்கும் ஒரு சாக்லேட்டோ ஒரு டாயோ வேணும். இந்த சாக்லேட்டோ டாயோ கேன் பி ரீடிங் அ புக், it can be watching something, it can be coloring, it can be listening to music. Anything like this will distract your pain, that will reduce or stop your psychological pain. So your pain will be reduced by 50%. So in the bullock cart example கொடுத்தேனோ அதுல ஒரு சக்கரம் ஸ்டாப் பண்ணிடுது, the other சக்கரம் cannot move much ahead. So your pain will be reduced. So like ma'am said, you have physical pain. Physical pain emotional discomfort இருக்கு, அதனால நீங்க அவாய்ட் பண்றீங்க, அதனால இன்னும் அதிகம் பெயின் ஆகுது, and the cycle continues, right? So break the cycle at the emotional discomfort. It's not in our control, but emotional discomfort is in our control. Rather than going in for avoidance and isolation, you say, I'll go out, I'll talk to people, I'll listen to music, I'll watch stuff, I'll read, I'll eat something I like, I'll exercise. That will reduce your emotional pain and you can reduce the cycle by 50%. உங்களுக்கு இந்த கான்செப்ட் புரிஞ்சுதா? யாருக்காவது இதுல ஏதாவது டவுட் இருக்கா? If you have any doubt, you can unmute and ask. Because this is a tricky concept. So யாருக்காவது ஏதாவது டவுட் இருந்தாலும் unmute பண்ணி கேட்கலாம். Okay, as there are no doubts, if you have doubts, you can put it in chat box and lastly we can handle those questions. Let us go to the next part. சரி மேம், நீங்க இவ்வளவு சொல்றீங்கல்ல ஆர்த்ரைட்டிஸ் இப்படி இருக்கு, ஆர்த்ரைட்டிஸ்னால சைக்கலாஜிக்கல் ஸ்ட்ரெஸ் ஆறுது, ஆங்ஸைட்டி ஆறுது, டிப்ரெஷன் ஆறுது, அதனால இன்னும் ஆர்த்ரைட்டிஸ் அதிகம் ஆறுதுங்கிறீங்க. சரி, இப்போ நான் என்னோட தாட்ஸை நீங்க சொல்ற மாதிரி மாத்துறேன், பட் அதனால எனக்கு என்ன பெனிஃபிட்? Okay, so the benefit is positive psychology, that is positive or situation பத்தி யோசிக்கிறச்சு. Arthritis, rheumatoid arthritis இருக்கட்டும், osteoarthritis இருக்கட்டும், you can easily deal with depression, anxiety, pain and fatigue. உங்க thoughts பாசிட்டிவா மாத்தினீங்கன்னா depression, you can stop depression, you can control anxiety, you can stop emotional pain, you can overcome fatigue. இதெல்லாம் கம்மியான எனக்கு arthritis related physical symptoms கம்மியாகும். And the advantage will be, உங்களுக்கு இப்போ அமுதா மேம் சில டிப்ஸ் அண்ட் ட்ரிக்ஸ் சொல்லுவாங்க, பிரீத்தி மேம் ஆல்ரெடி சொல்லிருக்காங்க, உங்க டாக்டர் உங்களுக்கு ஒரு மேனேஜ்மெண்ட் பிளான் கொடுப்பாங்க, அந்த மேனேஜ்மெண்ட் பிளான்க்கு யூ கேன் ஸ்டிக். இப்ப நீங்களே இப்படி நினைக்கிறீங்க, ஐயோ arthritis, I have got arthritis, now my life is over, what can I do? I have got arthritis, now I don't have any life left, I'm going to be bedridden, I'll not have any future. If you keep thinking like that, first you will go into depression or anxiety, which will make you forget things in your management plan. Second, no matter how much medicines we pop in, if there is no belief in the medicine system and in your body, trust me, no medicine will work. Trust me when I say this, your body knows the best. இதே நீங்க சொல்ல ஆரம்பிச்சீங்கன்னா, trust your body, trust my body, I trust my body ன்னு சொல்ல ஆரம்பிச்சீங்கன்னா, you will be surprised that your pain has reduced. எவ்வளவு பேருக்கு இன்ஃபர்டிலிட்டி இருக்கு, மெடிசனே ஒர்க் பண்ணாது, ஐவிஎஃப் எல்லாம் பண்ணிட்டு எல்லாம், it will all be a failure. But when they say, okay, எதுவும் பண்ண முடியாது, விட்டுடு, I will lead my life, suddenly they'll get pregnant. The same thing you can also find in many such, there was an experiment, okay, in which two set of rats எடுத்தாங்க. They took 2 sets of rats and to one set of rat they gave what do you say? To both the sets of rat, rather, 2 set of ratக்குமே அவங்க வந்து நிறைய fatty food கொடுத்தாங்க. Okay, so if fatty food is given more, then what will happen? உங்க எல்லாரோட blood reportல ஒரு விஷயம் வருமே, What is the thing you look into your blood report for fatty acids related stuff? Can anyone answer?
Cholesterol, ma'am.
Exactly. Fatty acids. Thank you, Manju ma'am. Fatty acids நிறைய சாப்பிடுறதுனால cholesterol அதிகமாகும். 2 செட் ஆஃப் மைஸ்க்குமே ஃபேட்டி ஆசிட்ஸ் கொடுத்தாங்க கொலஸ்ட்ரால் அதிகப்படுத்துறதுக்கு. ஒரு செட் ஆஃப் மைஸ்க்கு மட்டும் அதுக்கு உண்டான மருந்து கொடுத்தாங்க. இன்னொரு செட் ஆஃப் மைஸ்க்கு மருந்து கொடுக்கல. So இப்போ இந்த செகண்ட் செட் ஆஃப் மைஸ் இருக்குல்ல, what was expected that they will get cholesterol, they will get heart attack and they will die. Okay. So they studied this experiment for 5 months. Surprisingly, எந்த மைஸுமே செத்து போல. ரெண்டு குரூப்லயும் எந்த மைஸுமே செத்து போல. சரி, in the first set, for the first set of mice, we are giving medicine, so they will not die. But why is the second set of mice not dying? That was the question. That is when they started studying the mice and they found that the people who are taking care of the mice would take care of the mice very well. அதுக்கு நிறைய தட்டி கொடுப்பாங்க, அதை நிறைய லவ் பண்ணுவாங்க, அதை நிறைய அதோட விளையாடுவாங்க. அதனால the mice were very happy. And because they were happy, they were able to digest the cholesterol. So, நம்ம தமிழ்ல சொல்லுவாங்க தெரியுமா, சந்தோஷமா இருந்தா கல்ல கூட ஜீரணிக்க முடியும். If we are happy, we can even digest a stone, is what is told in Tamil. So, just imagine, if we are happy, our body works better. So, if you are happy, நான் இப்படி இருக்கேன், I did not choose arthritis, but whatever the situation is, I'll keep myself happy. I will not let arthritis stop me from being happy. I will not give that power and control to arthritis. நீங்க சொன்ன ஆரம்பிச்சீங்க. Trust me, your body automatically will start working to deal with arthritis and your pain will reduce substantially. Next question is, ma'am, you were saying why we should change the thoughts for managing arthritis. But நம்ம இதை change எப்படி பண்ணலாம்? How can we change our thinking? That is where or this whole system is based on. Okay. So how will we manage our arthritis? ஒரு கதை சொல்றேன். Am I audible to all?
Yes, ma'am.
Yes, am I audible to all? Okay, thank you. So ஒரு சின்ன கதை சொல்றேன். This is a real life story. Okay, this is one of my known people, one of my relatives. Okay, so and the lady was 97 years old. Okay, அவங்களுக்கு கண்ணு தெரியாது, காதும் ரொம்ப கம்மியா தான் கேட்கும். அவங்க தன் ஹோல் லைஃப் ஒரு ஹவுஸ் ஒய்ஃபா இருந்தாங்க. ஒரு லாஸ்ட் 10-15 இயர்ஸா கண்ணு பார்வை ஃபுல்லாவே போயிடுது. ஸோ இப்போ இந்த அண்ட் காதும் பேர்லி கேட்கும், கம்மியா தான் கேட்கும், பக்கத்துல போய் பேசின எனக்கு தான் கேட்கும். ஸோ when we have such a person in our house, what do we tend to do? We will think, okay, if we were that person, what will we tend to do? கண்ணு தெரியாது, காது தெரியாது. So we'll sit in one place only. We will not do any work. We'll just start complaining about life, grumping about life. We'll keep praying, God, take me away. I'm of no use. I'm a burden to all people. I'm a burden on this earth, on this planet. And all these thoughts will start coming to us. Am I right? But surprisingly, this lady who was 95 years old would wake up in the morning around 7:30. She will go take a bath. She will go till the place of worship in her house. She will worship God for 1 hour. She'll come to the dining table on her own. Someone will serve her food. She'll eat the food. She'll go and sit in her room. Then again in the afternoon time, she'll come. She'll have food. She'll go back to her room and listen to some God-related stories or something in the mobile or whatever the apparatus the family members will put in. She'll listen to that. Around 4 o'clock, she'll get up. She'll go out near their house where they will put the clothes for drying. She'll remove the clothes. She will fold the clothes. She'll keep it in their, in her own room so that people can come and take the clothes and go. In the evening, she'll again come and sit out. She will listen to people what they are talking. She'll have her dinner. She'll go back to sleep. And mind it, all of this she did on her own. No support for moving around the house. Rather than thinking that I'm a burden, she did whatever she could. She would fold the clothes. In fact, surprisingly, she would also, I'm really sorry. Yeah, call came in. Yeah. And also, surprisingly, she would also talk to the members about what they are going through. And this all things she would do despite she's blind. And she also had a spinal curve. That is, half of her body she will just bend. And she will get ready on her own and everything. Why am I sharing this story with you all? Is the willpower. I'm not dependent on others. She will talk to her children, to her grandchildren, great grandchildren. She'll give them advice. She will fold the clothes. She would say, I'm not a burden. I'm doing whatever I can, despite I cannot see, despite I having a spinal curve. Everything she would do on her own. So the moral of the story that I was expecting or I was bringing out through this information is, we have a problem called as arthritis. But can we survive with this? Do we want to live with this? Can we solve the problems? Yes, I have problems. But how can I think? How can I change my thinking rather than thinking I'm dependent on others? Can I change my thought process? And can I say, okay, I'll do whatever I can. I'll do whatever I can rather than thinking I'm a burden on others. And that is how we are going to change our thinking. And for that only, a few things will be helpful to us, like knowing our personal strengths and embracing our strengths. So for this one thing, if you all have a book and a paper with you, can you all just nearby whichever book or paper you have, can you just take it, or book and paper, book or paper or pen or and just write down. I'll give you 2 minutes time. Just write down what are your strengths. நம்மளான சில ஸ்ட்ரென்த் இருக்குல்ல, நம்ம நல்லா சமைக்க முடியும், நம்ம நல்லா கலகல சிரிச்சு பேச முடியும், நம்ம வந்து நல்லா பாட முடியும், நம்ம வந்து யாராவது கேட்க முடியும். We can listen to someone. What are your strengths? If you don't have a paper and a pen, you can also write it in the chat box. You can share it with everyone. We'll be very happy to know what are your strengths. Think about the strengths that you have. Can you do it? I give you 2 minutes time. Okay? And your time starts now. Think of what all are your strengths and mention it. Yes. Thank you, Ms. Cranston. Praying you feel is your strength. Wonderful. What strengths do you have? உங்களோட என்ன strength? Arthritis இருக்கு. Yes, we have arthritis. But along with that, we have certain strengths. Maybe we can counsel our children very well. Maybe we can provide good guidance. Maybe despite arthritis, we are able to do small things such as folding clothes or serving food, or after the food is over, keeping the things back in its place. We must, or we are guiding our grandchildren for doing homework. These are all our strengths. Yes, 1 minute or 1 more minute left. I do wall painting, artwork, wonderful. Believe in yourself, you say can do wonders. Definitely, Cranston, Ms. Cranston, thank you. Yes. Okay. So we'll stop. Hope you all have returned. What are your strengths? Hope you all have written what are your strengths. If you have not written, please do write. Yes. Wonderful, wonderful. Oh, I can sing. 5 feet tall wall you have painted. Wonderful. That is good. So please, if you have not written your strengths, please take out a paper and write all your strengths. Okay, because when you write your strengths down, you start believing in it. Achcho, arthritis thavri ivla positives and larka. I have these many positives. That means I can start working on things, right? Apart from embracing our personal strength, expressing gratitude every day. Yes, I have arthritis, but despite that, I have wonderful children. I have wonderful grandchildren. I am able to do these many things. I'm still alive, right? Thanking at the end of every day, you can thank God, you can thank yourself, you can thank your family. Just send the vibrations in the atmosphere. Thank. When you thank, your body starts, cell division begins, goes at a good rate. And that will also help you overcome your arthritis. Every day, night, thank for 5 things. Similarly, finding purpose in your life. This is builds neurological levels of uh, a person's needs. Okay, in which we have environment, we have behavior, we have our skills. Despite having a change, number life before arthritis and after arthritis, it has gone in for a subsequent change, right? So, what are the environmental changes that have come? What are the behavioral changes that have come? What are the capabilities and skills I need to develop? What changes in my values and beliefs should I bring? Rather than thinking I'm a burden, can I start thinking how I can be helpful? Finding a new identity with arthritis. And the main thing is purpose. What can I do even if I have this arthritis? How can I be useful to society? Setting and achieving goals. Once your purpose is clear, set small goals and try to achieve those goals. You must have had certain past goals, right? But because of our life, we would not have been able to do it. Now, arthritis is giving us a time to learn those social relationships. Okay, I'm not able to move much, fine. But that doesn't stop me. I have some mobile. I can reach out to people. I can talk to people. I can get in touch with people. I can establish good relationship. Arthritis is only in the joints, only in the joints, not in my tongue, not in my thought. I'm not having arthritis in my tongue and my thoughts, so I can foster relationships. Having compassion. This gives a good time for us to think about our environment as a whole. And developing resilience. Resilience is when we fall, the strength to get up and walk again. We have had a big, I don't deny it, yes, a very big problem called as arthritis. Okay, but I accept it. I did not choose it. It came to me, fine, I accept it. Now, how can I solve this problem? What all can I do? I cannot walk. Can I take a support of a walker? If my joints are paining, can I ask for pain medications? Can I try distraction techniques? Can I keep myself engaged? How will I develop resilience? And engaging in meaningful activities. Reach out to people and help them. That will also give you a sense of purpose. How can you help your next generation? How can you help your neighbors? How can you do good love? Kande, so many things nowadays the internet allows us to do. Online, you can work out in so many ways. Can you do it? Reach out to the society, change the society, and live in the present moment. Don't think, you have got arthritis, now what will happen of my future? Or don't think, oh, how I lived, now how I am. No, present. Okay, I have it. Now what should be the question? How can I change this world? And pursue. You all have written such wonderful hobbies. Pursue your hobbies. These things itself will bring a big change in your life. People, those who are attending today's session, if you can do these things, it will help you reduce your pain and help you manage arthritis. Try out at least gratitude and personal strength. Please try out. Okay, that will really help you. Well, resilience, try out. Distraction will help you reduce psychological pain. And don't put yourself down. Go out and fight arthritis. Trust your body. Thank you so much for being such wonderful audience. You have any doubts, we'll take it in the last part of the session. I request Dr. Amudavarshini to kindly continue from here. She'll be taking she'll be sharing information with you related to all the naturopathy and natural remedies. Ma'am, to you, please.
Thank you, Neha ma'am. Yes, namaste and good evening once again. So let me just share my screen. Just 1 minute. Okay. So before starting, I would like to share with all of you that in naturopathy, we believe that every body is different. So every one of our body is different, and each of our body reacts in a particular manner to particular treatments. So whatever I'm going to be talking about right here will be a general basic guideline on how we tend to manage arthritis in naturopathy. But before you start any of these guidelines, my request to all of you would be, please take a professional guidance from a professionally qualified naturopathic doctor, and then you can start the treatment of naturopathy. Yes. So moving on. So what and all different modalities in naturopathy do we have for arthritis? So naturopathy is a very vast system. It has a lot of branches of treatment in it, and some of which definitely need the practitioner to be present for that particular treatment to be given to you. And some of which we can try at home, but after having the guidance of a practitioner. So for arthritis, the major aspects of treatment would be, first thing is diet and lifestyle modifications. Second is yoga. Third is hydrotherapy, aromatherapy, acupuncture, and acupressure. Okay. So moving on, we'll start focusing on your diet. So Preeti ma'am already told, we have a specific kind of diet for arthritis, which is called as anti-inflammatory diet. Inflammation means any kind of swelling in your body. ஏதாவது ஒரு பர்டிகுலரான ஒரு இடத்துல ஒரு வீக்கம் அப்படின்னு வந்துச்சுனாலே, that is called as an inflammation. Itis indicates inflammation in the body. So அந்த inflammation போக்குறதுக்கு we will have to stick on to a diet which is called as anti-inflammatory. Anti means stopping or opposite of inflammation. So anti-inflammatory diet. So on the diet, what and all will be the main components? Okay. So first will be your fruits and vegetables. So fruits and vegetables, particularly your berries, that is your strawberry, blueberry, raspberries, gooseberries, all those kinds of berries. Leafy greens like your spinach, broccoli, all those leafy green vegetables, and cruciferous vegetables like your cabbage, etc. All those play a major role in anti-inflammation. And next will be your whole grains, okay, like oats, quinoa, brown rice, whole wheat. Why? Because once you go in for a processed, like adulterated, skin peeled off kind of grains, what happens is there is a
I think Amuda ma'am's
Yes.
video has got paused.
Yes. So
Yeah.
I will share her presentation. She'll join back.
So
Yes, I will just keep sharing her presentation. She will join back in a moment. Is my screen visible, ma'am?
yes, ma'am.
Yes, just a minute. So ma'am was here. Let's just wait for ma'am. Meanwhile, the question
Yes,
was...
there was one query.
Yes,
Yeah, there was one query. Yes, so one person, Mr. Siddharth, you had asked that you feel bad if you would walk, you are walking with the help of a walker and you feel bad, what will people think about you? So my question for you is, Mr. Siddharth, uh, how many of these people are actually thinking about you? When you go out, how many people do you actually notice? Say when I am walking or when I walk out, I'm always usually like, okay, this is the time I have to go, this is the next work, this is the next work, this is the next work. For me, hardly I notice people, and with the advent of mobile, I hardly see people. So do you think all the people are there only to look at you? That is the first thing. The second thing, even if they are looking at you, what is the value of that thoughts that you are giving to yourself? Why are you giving or placing value to that thoughts? Okay, I feel conscious, I feel old, though I have arthritis at 40 itself. Oh, okay, Amuda ma'am has come. So Siddharthi, I'll answer, will continue this. Amuda ma'am, over to you.
Yeah, sorry about my internet. It's just a little unstable. I'm really sorry.
No issues, ma'am. Yes, please continue.
Okay. So I think we left at healthy fats, inclusion in our diet. Yeah. Okay. So talking about healthy fats, so majorly avocados and olive oil. So why should we include these healthy fats in our diet? Is because these healthy fats are rich in antioxidants. Yeah. So these antioxidants play a major role in decreasing the inflammation in your body. Yeah, so we call this process like oxidation. So oxidation is what happens when there is an inflammation. So usually when there is an inflammation, you tend to have free radicals in your body. Okay, so those are just normal, like just left alone free ions in the body. So these ions, what happens is they undergo a process called as oxidation. So this oxidation of free radicals is what leads to inflammation. Okay, so it is very essential for us to include a lot of antioxidants in our diet, which will prevent this oxidation of free radicals. So once that is done, it will automatically decrease our inflammation. Yes, so inclusion of avocados and olive oil in the diet is essential because they are rich in antioxidants. Again, next would be your almonds, walnuts, chia seeds, and flax seeds. Why these four basically is they are again rich in antioxidants as well as they are rich in omega-6 and omega-3 fatty acids. So this omega-6 and omega-3 fatty acids are very much essential for the utilization of antioxidants by our body. Yes, so it is very essential for us to include these omega-rich foods in the diet for proper utilization of antioxidants, thereby reducing the oxidation of free radicals, thereby decreasing the inflammation. Yeah. Okay. So next is legumes. Yeah, legumes or your pulses like your beans and peas. Again, why? Because they are rich in fiber. So the fiber content is also essential to keep the lubrication of the joints alive. Yes, so once there's a good lubrication to your joints, what happens is there is normal, like just natural flow of movement in your joints. Yes, so once there is a disturbance in the lubrication, what happens is that is when you start to experience the kind of friction in your joint, which leads to, two bones just coalescing against each other, leading to bone pain and ultimately arthritis. Now, coming to the most important category of your diet will be your spices and herbs. Yes, these are like just the common herbs. Yeah. So these are just the common herbs which are available in our kitchen, like we use them daily. But like most of us are not aware of the ultimate medicinal properties which these simple herbs have. For example, in turmeric, you have a component called as curcumin. Yeah. So this curcumin, and in ginger, you have a component called as gingerol. In garlic, you have allicin. and cinnamon, you have cinnamaldehyde. Yeah. So all these components possess a great amount of antioxidants, and also they have vasodilating properties. So vasodilating properties in the sense your blood flows through particular channels in your body. So உங்க body full-ஆ ஒரு particular route இருக்கும். நம்ம எப்படி இப்போ ரோட்ல போகும்போது ஒரு particular way follow பண்றோமோ, அதே மாதிரி the blood in your body, it follows a particular path. So that path in which the blood flows are known as your blood vessels. Okay. So whenever there is an inflammation, one classical sign would be constriction of your blood vessels. So unga blood vessels normally diameter vida, it would have shrunken more. So what happens when there is a shrinking of your blood vessels? There won't be enough flow of blood. And once there is no enough flow of blood, the essential oxygen content or the essential vital nutrients required for that particular place will not go there. So adanga pogadadunala, what happens is ultimately it will lead to a condition called as ischemia. Ischemia is loss of blood supply to one particular place. Okay. So and the blood supply proper pogala abdina automatically and ஒரு particular place la ஒரு வீக்கம் form ஆயிடும். That is ஒரு inflammation form ஆயிடும். So, அதை தவிர்க்கிறதுக்கு, to ensure proper blood supply throughout your body, we will have to take in herbs and spices or foods in general, which have this vasodilatation properties. So, adila irukra 4 important herbs would be turmeric, ginger, garlic, and cinnamon. Okay. So, idellame you can either, you can use it as a tea or a kashayam and have it, or you can use it as a, you can just boil cinnamon in water and have it as a cinnamon tea. And the madri, you have different methods in which you can take these herbs and spices in your daily diet. Yeah, but again, before incorporating anything into your diet, please make sure that you consult a professionally qualified physician and then you start with the diet. And coming back to what Preeti ma'am had earlier spoken about, the gut bacteria skeletal axis. That is, on your digestive system, you will have microbiomes, that is your bacteria. Okay. So those bacteria are the good bacteria. Okay. So those bacteria, they play an important role in the skeletal health of your body. That is the bone health of your body. So on the bacteria, proper balance la maintain panada, it will enable us to have a very good health. So to maintain the good health or the good harmony of the bacteria, we have 2 kinds of food which are very essential. So one is prebiotics and the next is probiotics. Yeah. So the prebiotics are actually the food for the bacteria. அதாவது உள்ள இருக்கிற பாக்டீரியாவை வளர வைக்கக்கூடிய தன்மை உள்ள பொருட்கள் எல்லாமே வந்துட்டு prebiotics. Probiotics அப்படிங்கிறது என்னன்னா food which have the bacteria in them. அதாவது அந்த நம்ம சாப்பிடுற அந்த ஃபுட்லயே நம்ம கட்ல இருக்கிற அந்த good bacteria will be present in it already. Yeah. So examples of prebiotics would be your banana and your Greek yogurt. Okay. And probiotics will be your buttermilk, your your buttermilk will be your example of a probiotic, and also the fermented foods which we eat, like your dosa, idli, appam, whatever we ferment it overnight, no, and the ubbi vara porutkal ellame, those are probiotics. Okay, and the ubbarthukana reason is because of the bacteria inside it. So that is what is called as probiotics. So எப்பயுமே நம்மளோட டயட்ல prebiotics இருக்கணும், probiotics இருக்கணும். இந்த ரெண்டும் இருந்தாதான் it will have a good balance for the gut microbiome. Yeah. So moving on, now we have spoken about what and all foods we'll have to take. Okay. So next we'll speak about what particular kind of foods we will have to avoid. கூடவே கூடாது அப்படிங்கிற பொருட்கள் பாத்தீங்கன்னா, first is trans fat. Okay. Trans fat is nothing but your processed foods, like your processed junk foods, fast foods, which tend to have a lot of masala in them, lot of spices in them. Yeah. So which tend to have a longer shelf life. And, the sad truth is which tend to be more tasty, obviously. So these trans fats, again, what will happen if you take in a lot of processed junk foods or the trans fats is, it will increase the insulin resistance in your body. So what is insulin? Insulin is a particular hormone which tends to bind to the glucose molecules so that it kickstarts the glucose metabolism. So glucose is our body energy. Okay. So once you eat the food and the food gets digested, there will be release of lot of glucose molecules in the body. Okay. So in these glucose molecules will go and bind to the insulin. Like insulin will have glucose receptors. Okay. So it will go and bind to the insulin like this. And then this glucose will be metabolized. Process agi, it will turn into energy. So what happens when you have excess of processed foods is you will end up taking in a lot of glucose molecules than the body needs. So what happens is one particular insulin molecule can get bound only to some particular amount of glucose molecules. Apart from that, anything which is excess will obviously tend to free flow in the body. Okay. So when there is less of insulin molecules and there is more of glucose molecules, what happens is some glucose molecules will be left alone in the bloodstream. So those, what will happen is it will start getting stored as fat in major areas of our body. For example, the lower abdominal fat. So once that fat starts getting deposited in the major areas of our body, it starts to release the stress hormone. Okay, because the fats tend to put pressure on your particular organ. So once there is a pressure, it always indicates there is a stress to the body. So and the cortisol is your stress hormone, and that is released because of this excess amount of fats which is stored in your body. So it is highly essential that we try and prevent insulin resistance to the maximum so that we, just keep our stress levels at bay. Okay. Next is we should avoid excessive salt. Okay. Salt, what happens is the sodium chloride in it causes water retention in your body. அதாவது தண்ணியை உள்ளேயே சேர்த்து வச்சுக்கும். It won't let the water go out. Okay, so this water retention, what it would cause is it will cause a lining around your organs, whatever organ it may be. Okay, so this excessive salt, it will form a water membrane around your organs. So anything which forms around your organs will put pressure on the organ, again leading to stress. So it is highly essential that we cut down on salt. I'm not telling that we should nullify salt. We should just cut down on salt. Like maybe if you are taking like 1 spoon of salt, we can maybe cut it down to how more better it is.
I think we again lost Amuda ma'am. So regarding the question which you were answering, Neha ma'am, you can continue. And regarding the question on ghee, let Amuda ma'am answer once her session is over, ma'am.
Yes, ma'am. So Siddharth ji, I totally understand. You are going through a difficult time, especially when we have arthritis at a very young age. But as you said in your statement itself, it says, I feel conscious. So it is more related to us than outside. So I would suggest, if possible, you try to bring your thoughts to an alignment. So if possible, you can get in touch with us as well, or you can get in touch with any counselor, because it's more related to you than it is outside. We will be sharing our number as well. Feel free to contact us, or you can contact any counselor who is nearby your house. Okay, we do provide online and offline counseling. Yes, Amuda, I'm sorry, you can continue.
Yeah, ma'am, sorry. So now that we have seen about diet, we will now start with our lifestyle modification. So diet is also a part of lifestyle modifications. Now next would be just our general modifications which we'll have to follow throughout the day. Okay, so first is staying hydrated. So a minimum of 2.5 to 3 liters of water per day is very essential, irrespective of the season. Be it winter, be it the rainy season, be it summer. You should keep a target of max at least 3 liters of water per day. Because what happens is water tends to flush out all the toxins from your body. It just acts as a good gushing effect, which just brings out all the toxins which are stored in the body at different places. So it is very essential for us to stay hydrated throughout the day. 3 liters of water to start with, 3.5 liters, and gradually proceed. Has to be there so that you don't put pressure on your weight bearing joints. Yeah, as Preeti ma'am had already discussed.
So I have shared our helpline numbers. So whoever wants to ask any medical related questions, which doctor to go, is this food okay? Is this treatment okay? Or for free psychological counseling, for free medical, it's all free medical guidance and free naturopathy guidance. Kindly, you can contact us in these numbers. And regarding ghee, this is my information, but we will wait for Amuda ma'am to add on to. Ghee is used in Ayurveda as an anti-inflammatory agent. So ghee வந்து கண்டிப்பா அளவான அளவுல நீங்க யூஸ் பண்ணலாம் தேவையான அளவுக்கு in the adequate quantity. Anything is always fine as long as you take it in minimal and adequate quantity. And ghee is actually advised for better anti-inflammatory properties. So we'll wait for a few more minutes for Amuda ma'am to join.
And also, yes, like I was previously saying, we cannot control things that are outside our reach, like what people think, what people will do. But yes, how we think about ourselves can be changed. How we think about our problems can be changed. So yes, arthritis is a big thing. It's not a small thing. You are dealing through a lot. So there is definitely a chance of having lots of irritation, frustration, depression, anxiety, stress. So how to manage through it? So there is a separate branch of counseling called as medical counseling, which will help you deal with your current problems and how to overcome your thought process and control things that are under your control. That is our thoughts, our tendencies to self-doubt. If we can address these things, half of our pain, half of our problems related to arthritis will reduce.
Amuda ma'am has joined, but regarding surgery, yes, actually most of it, the 86% of the knee replacement surgeries are very, very successful, and 95 and more % is successful when the patient is younger. And I think Mr. Siddharth mentioned that he's 40 years old. So definitely surgery has got very, very good chance of no recurrence. It has got good outcome in your age. Only when there is for older people, even after surgery, if we are not going to manage or maintain our weight or maintain the joint health, then there is chance for resurgery. Surgery நல்லது, வயசு கம்மியா இருந்தா சர்ஜரியோட அவுட்கம் பெட்டரா இருக்கும். வயசானாலும் ஆக்சுவலா 65 to 75 வரைக்குமே இப்பெல்லாம் சர்ஜரி நல்லாவே எஃபெக்ட் கொடுக்குது, நீ ரீப்ளேஸ்மெண்ட், ஹிப் ரீப்ளேஸ்மெண்ட். பட் அவங்க அந்த சர்ஜரி முடிச்சுட்டு அவங்க சொல்றபடியெல்லாம் நல்லபடியா மெயின்டைன் பண்ணணும். மெயின்டைன் பண்ணலன்னா அப்ப ரெக்கரன்ஸும் ரீசர்ஜரி வரதுக்கான வாய்ப்புகள் அதிகம். அமுதா மேம், யூ கேன் கண்டினியூ மேம்.
Yes, ma'am. Thank you. Okay. So next would be adequate sleep. So adequate sleep of at least 6 to 8 hours per day for an average adult population is very essential, because the lesser you sleep, the more your body gets stressed. Okay, because what happens is when you sleep peacefully, when there is a very deep sleep, your body tends to calm itself down. That is, your heart rate reduces, your blood pressure comes down. You tend to go into a complete relaxation, both physically, which is external, and internal for all your organs of the body. And also mentally, you are at a very calm state of mind. Yeah, your brain waves tend to, the brain waves which are essential for the calmness, they tend to get emitted when you have a very good night's sleep. So it is always essential that you have at least 6 to 8 hours of sleep per day. Okay. And next, the most important thing would be sun exposure. I'm not talking about the sun rays which come out when we all go to the office, not that time. I'm talking about the sun rays which, just touch the ground when the sun rises. That is the first few rays of sun. So those are very essential because they are very rich in the UV rays, that is the good UV rays. So those UV rays, when they come in contact with your bare skin, what happens is they release a component called as nitrous oxide. So this nitrous oxide is a vasodilator. As I mentioned earlier, vasodilation na blood vessels expand பண்றது. So blood vessels இப்படி விரியும் போது there is a good blood flow. So, அந்த UV rays, அதாவது morning say ஒரு 6 to 8 o'clock and evening maybe around like 4 to 6 around the time when the sun sets. That is, you feel that evening breeze and the morning breeze இருக்கும்போது அந்த இதுல when you expose yourself to that beautiful sun rays, you will not only feel refreshed, but it will be a refreshing effect for the internal organs in your body as well, because they tend to have a good circulation of blood. Okay. Next, moving on to yoga for arthritis. Yes, so these are just this is for general arthritis. Yeah, in a gist. So some few asanas would be Marjorie asana, which is also called as the cat cow stretch. Next would be the balasana, which is also called as the child's pose. Next is Adho Mukha Swanasana, that will be downward facing dog. Vrikshasana, which will be the tree pose. Paschimottanasana, which will be the forward bend. And bridge pose will be the Setu Bandhasana. So all these asanas, what they will do is they work on all of your joints in the body. So yoga in general will actually improve the awareness, towards the physical body as well as the mental body. So regular practice of yoga, when incorporated with awareness of breathing, it tends to give not only a relaxed feel to your physical body, but also for your mental body. So all these poses in themselves are beautiful relaxation poses, and also they tend to stretch almost all the joints in your body. So once those joints are stretched and relaxed and they are moved and there's good movement, automatically what happens is they will start becoming more healthier. The more you move, the more healthier you become. Okay. So these are just specific yoga poses for arthritis. Again, which pose, whom to practice, a practitioner would be able to guide you much more in detail. Yeah, because everybody will need a specific yoga therapy module for themselves, depending on their body's capability, depending on their body's flexibility, adaptability. A practitioner will be able to guide you as to which and all poses you will have to practice, for how many rounds you will have to practice, for how many seconds you will have to maintain, etc. So this is just a general gist of how yoga would be for arthritis. So specific asanas for knee would be 3 beautiful asanas. One is Tadasana, next is Utkatasana, and next is Viparita Karni. Okay, so Tadasana, as you can see here in the first picture, the entire
question in the chat box. Please repeat the sun exposure timings, ma'am.
Okay, so the sun exposure timings would be from morning 6 to 8 a.m. and evening. If morning is always the most preferred time, if you don't find in the morning, the evenings would be like 4 to 6 p.m., like 4 to 5:45, like just before the sun sets. Yeah, am I clear? Okay. Right. So yes, so coming back to yoga for arthritis of knee, Yes, so this Tadasana, if you can see, there's this entire stretching of the spine. Yeah, the entire spinal vertebra, they get stretched a lot. And also you can see here, the toes and the legs are also pulled up. So what happens is there is a good massage to your knees. There is a good stretch to your knee bones. That is the knee joint bones. So that gives a good stretch, thus enabling it beneficial for your arthritis of knee. The same for Utkatasana, where there is a good extension or there's a good stretch given to the knee joint. And in Viparita Karni, why we focus on Viparita Karni is because when you put your legs up like this, what happens is there is good blood flow throughout your body. That is, for some of us, what tends to happen is the blood tends to pool down in our lower limbs, okay, especially in our calf muscles or around the ankle joints. So that may not come out as a sign per se, but most of us, there's no backflow of blood from your lower limb to upper limb. So when you practice this Viparita Karani, like legs up on the wall pose, a 90-degree pose, the pooled blood in your lower limb tends to flow back. So that initiates a good flow of blood throughout your body. Okay. Now coming to mudras for arthritis. So mudras are like hand gestures, okay? Just like how in Bharatanatyam we have mudras. The same way in yoga for any practice of pranayam or in any practice of meditation, we tend to adopt mudras or hand gestures. So the mudras which are specific for arthritis would be three. One is Hridaya Mudra, Chin Mudra and Jnana Mudra. Yeah. So Hridaya Mudra, as the name suggests, it is actually the mudra for the heart health. Okay. But this tends to improve circulation in our body. So anything which is concerned with the heart is also concerned with the circulation. So once we practice this mudra, it will enhance the circulation in the body, thereby enabling good blood flow to all the joints and muscles throughout your body, which will reduce the pain and swelling, that is arthritis. So how do we do this Hridaya Mudra is, your thumb and your, at the base of your thumb, you'll have to fold your forefinger. That is, the tip of your forefinger should be folded at the base of your thumb. Okay. And then your middle finger and your ring finger are touching the tip of your thumb. And then your little finger is straight. So this is Hridaya Mudra. Yeah. Is everybody able to see me?
Yes, ma'am. Yes, ma'am.
Yes, ma'am.
Okay. Yeah, thank you. Right. So this is how we do Hridaya Mudra. Base of the thumbல உங்களோட ஆள்காட்டி விரல் இருக்கணும். உங்க தம்போட டிப்ல நடு விரல் மோதிர விரல். உங்களோட சின்ன, that is your little finger will be straight. So this is Hridaya Mudra. Okay. So next is Chin Mudra. Chin Mudra is very simple. What we usually practice during yoga, that will be this. In the tip of your forefinger and your thumb is brought together. Okay. And then you turn your palms up and you keep it. That is Chin Mudra. Okay. And Ide Mudra, when you turn it down and keep, will be Jnana Mudra. Okay. So what happens when we practice these three mudra is, in yoga, we believe that we have prana, that is the vital energy flowing throughout your body. So when the fingers come in touch with the tips, like the fingertips come in touch with each other, what happens is there is this good kick-starting of proper circulation of prana. That is your vital energy. So once there is good circulation of prana, automatically all your inflammation and swelling tends to go down. Okay.
There's a question, ma'am. How long should we keep this mudras, ma'am?
Again, mudras will be specified to you, like depending on for how many minutes you'll have to maintain, depending on your condition, depending on the severity of your condition, depending on your age, depending on the lifestyle and the physical activity you do. We will prescribe the amount of time you'll have to maintain. But usually on average would be 3 to 5 minutes to start with. But again, please consult a practitioner and then they'll be able to guide you better depending on your body. Okay. So next is chair yoga. So chair yoga is also known as yoga at desk or ergonomics. So for patients with severe arthritis who are not able to sit down on the knees, like on the floor, they're not able to bend their knees as such. So this chair yoga comes as a huge benefit for them. So in that, you will have a seated cat-cow pose, seated forward bend, and seated twist. Seated cat-cow would be you just sit on the chair straight and then you just move your spine up and spine down. Seated forward fold will be the second picture where you tend to extend your legs out and then you do a forward bend. Okay, and the seated spinal twist will be where you is just twisting of your spinal vertebra. So all this can be done by people who find it difficult to sit on the floor, or just put your knees on the floor and practice. So this chair yoga, again, you will have specific poses depending on your condition. This is just a general list of asanas which will be prescribed. And breathing exercises, again, breathing exercises are not only for your physical health, but for your mental health also. So in that, 3 most major breathing exercises would be your deep abdominal breathing, alternate nostril breathing, and Brahmari pranayama. Yeah. So deep abdominal breathing is where you place your hands on your abdomen and then you take a deep breathe in and a deep breathe out. So that time when you breathe in, your abdomen should come out like a balloon, and when you breathe out, your abdomen should go inside. So that is when you will actually tend to keep focusing on your breath, and that will ultimately calm down your mind. Again, alternate nostril breathing or Nadi Shodhana is also called as psychic channel purification pranayama. So the psychic channel, by psychic channel, I mean the channels or the paths in which the prana or the vital energy flows through the body. Okay. So this particular pranayama is proven to clear out all the energy blockages in the body. So there's some kind of energy blockage. I'm not talking about physiological blockage. I'm talking about the spiritual aspect of yoga, where we, energy, that is the vitality. Ungaloda health maintain pannakoodiya or energy per the vitality. So, and the vitality engayavadhu or block madri anga maatikichu appadina, in the particular pranayama நம்ம ரெகுலரா பண்ணிட்டு இருக்கும்போது, it will release that energy blockage and it will enable good flow of prana or vitality in your body. Okay. And next is Brahmari pranayam. So Brahmari pranayam pannumbodhu, there's usually a humming breath or humming sound which we do. So that humming sound tends to vibrate throughout your head and your body. So that particular vibration will release a component called as nitrous oxide. In the nitrous oxide, the same thing which I told for sun exposure will occur in this also. The same nitrous oxide will be released, which is a vasodilator, which will actually give a good blood flow to all the body parts. Okay. Okay. So next, now that we have covered diet, lifestyle modifications, and we have completed yoga. So next is hydrotherapy. So what is hydrotherapy? Like from the name itself, you can come to a conclusion. Can anybody tell me what hydrotherapy is? What can you understand from the term hydrotherapy? Anybody?
Someone has put in the chat box water.
Okay. All right. Thank you, ma'am. Yes, exactly. So hydro means water and therapy is just therapeutic use of water. That is, how is water beneficial to the body? That is what is hydrotherapy. So in water therapies, we have 2 different temperatures. One is hot and one is cold. Okay. So depending on the condition, we will be prescribing you if you need to go in for hot or if you need to go in for cold. Okay. So for arthritis in general, we would prescribe warm baths with Epsom salt or warm compresses with Epsom salt. So what is this Epsom salt? Epsom salt, it will be a crystallized salt which is made up of magnesium sulfate. Okay. So this magnesium sulfate has wonderful analgesic properties. Analgesic in the sense pain relieving. So any inflammation, itis, okay, and the inflammation it will always cause pain. So and the pain relief பண்ணக்கூடிய தன்மை உள்ளது இந்த Epsom salt. Okay. So நீங்க குளிக்கிற தண்ணில you can put in like 2 to 3 small spoons of Epsom salt crystals, or illa unga pain இருக்கிற ஏரியால you can just dip a cotton cloth, put some Epsom salt crystals on it and tie it as a pack and keep it. அப்படி இல்லாட்டி you can keep cold compresses. Cold என்ன பண்ணும்னா it will improve the blood flow. Okay. So cold compresses, you're not supposed to keep it during your pain. When you have pain, don't keep cold. On the other days, when there is no pain, you can keep cold to strengthen your particular organ. When you have pain, you should always stick to hot. Okay. Yes. And then, yes, you can use this salt for shoulder pain also, ma'am. But again, please, just refer to a proper practitioner, get their guidance, and then they will specify to you as to how exactly you'll have to use this salt. Yeah. Okay. And
Okay.
next is alternate hot and cold compresses. Again, not during your pain days, but during your normal days to strengthen that particular area. Okay. And warm rock salt compresses. இது வந்து நம்ம வீட்லயே கூட பண்ணுவோம். We'll have the rock salt crystals, which we just tend to dry roast it in a tawa or pan, and then we will tie it in a hot cloth and we'll give it on areas where there is pain. Usually they do it in all our households. அது வந்து உப்பு ஒத்தடம் அப்படின்னு சொல்லுவாங்க in Tamil. So that also can be done for arthritis. So moving on to aromatherapy. Aroma means smell, okay? And therapy means, can we use fried rice husk or yumi? Sorry, ma'am. Sorry, Hema Malini ma'am, but what do you mean by fried rice husk? Because I mean, I'm sorry, I've not heard of it.
உமினா அந்த நெல்லோட ஏதோ ஒரு ஹஸ்க் யூஸ் பண்ணுவாங்கன்னு நினைக்கிறேன் மேம். உமி.
Okay, but we, I'm not sure about that, ma'am, but we usually tend to use only rock salt or Epsom salt in naturopathic treatments. So I think it's better that we stick to that only, or we can also use mustard packs. But again, mustard packs, not everybody uses it. So I think it's better that we stick only to salt. Yeah. Okay. So coming to aromatherapy. So aromatherapy is nothing but essential oils, we call them. So those are derived from plants or flowers in general. So the most pain relieving aroma oils would be lavender, eucalyptus, peppermint, rosemary, and chamomile. Okay, so these tend to have the anthocyanins in them. They tend to have the phytonutrients in them, which give a good pain relieving effect on the body. Okay, so these aroma oils, you will have to actually go to an organic store and get the most purified aroma oils possible. Nowadays in market, we get a lot of aroma oils, but we don't know about the purification of them, like how purified or how organic they are. So if you could go to any, organic aroma oil shops, like you can actually get them at the best concentration possible. Okay. So how do we use these aromatherapy? Like how can we install aromatherapy in our regular practices? 4 methods are there. One is diffusion, one is massage with dilution, next is baths, and then inhalation. Okay, diffusion is where just like a normal room freshener technique, where you'll have a diffuser like this, yes, and then you'll just have to put in 2 to 3 drops of the aroma oil in it, and then it just the vapors just go around the room, giving that good aroma. Okay, next is massage with dilution. Massage is, we all know, just gentle movements in the body with that oil. But what do we mean by this dilution is, நம்ம எந்த aroma oil use பண்ணாலும் it will be highly concentrated. So anything which is highly concentrated will actually be sensitive to the skin. It might cause some irritability or some rashes to the skin. So now it is very essential to dilute the oil with a carrier oil. For example, if you're using lavender aroma oil, you can always dilute it with almond oil or jojoba oil. So those are called as carrier oils. Okay. So you can always mix it up, and then you will have to apply it on the skin or on the part where you're feeling the maximum pain. Okay. And baths. Baths again, normally the water in which we bath in that bucket, you can just add 2 to 3 drops of the particular aroma oil, and then you'll just have to take a bath of it. And then inhalation. Inhalation is just, in a normal tissue or in a normal cotton cloth, you just put in 2 to 3 drops of the oil, and then you'll just have to keep inhaling it whenever you're feeling, whenever there's a pain or whenever you feel like throughout the day, you'll just have to keep inhaling it. Yeah. So these are aromatherapy techniques. Again, which aromatherapy technique will suit you, that will be guided to you by a professionally qualified naturopathic doctor after a thorough consultation. Yeah. So acupuncture and acupressure, this actually is just to give an introduction about it. So this one, please not try at home without getting the guidance of a doctor. Actually, this has to be given by a doctor. We can't just give it to us on our own. Okay, so please make sure that you take the guidance of a doctor and make sure that the doctor gives it to you. Yeah, so these are just a list of points which the doctor might be giving to you for arthritis. It can be in the form of acupuncture. Acupuncture is a treatment where we use needles. Yeah. So needles will be pricked in specific points of your body, and that will release, chemicals inside your body. Yeah. Those chemicals will be able to reduce your pain, reduce your inflammation, and improve your blood flow. Yeah. Again, acupressure is where we just give pressure. We have an instrument for acupressure. It will be just like a pen from where we'll just keep giving pressure, or we can just give pressure with our normal thumb itself. Yeah. Acupuncture is the use of needles. Acupressure will be, just giving good pressure on that one particular point. Again, I'm repeating, please take the guidance of a doctor and please make sure that the doctor gives it to you. Please do not try this at home by yourself, because every body reacts in a different way to different points. So we will see your pulse, and then we will decide on which point we will have to give you. So this is just an introduction or just a normal sharing of information, not to be practiced at home. Yeah. Okay. Yes. And most importantly, next would be maintaining a good mental health. Whatever we do for our physical health, yes, that is also important. But maintaining a good mental health is also equally important, because everything is connected. Okay. So for maintaining a good mental health, the first thing would be a well-balanced diet. Diet is not only for your physical body, it is not only for your weight, it is not only for your heart health or gut health or something. It is equally important for your brain. So what you eat is what you become. So a well-balanced diet rich in whole fruits and vegetables. Why fruits and vegetables is because the moment you eat fruits and vegetables, there is a component called as tryptophan, which gets released into the bloodstream. So this tryptophan, it works as a wonderful mood enhancer. That is, it gives you a good mood. You feel refreshed, you feel light, you feel calm once this tryptophan is increased in your body. So that tryptophan will be secreted in your body when you have a diet rich in whole fruits and vegetables. Yeah. Not by whole fruits and vegetables, I do not mean the juices. Not the juices, just your fruits cut and have. That's it. Okay. Next is maintaining a good gut health. Just like how I mentioned before, there is a gut skeletal axis. In the same way, we have a gut brain axis. So அந்த கட்ல இருக்கிற அந்த பாக்டீரியா நம்மளோட ஸ்கெலிட்டல் போன்ஸுக்கு மட்டும் இல்லாம நம்மளோட பிரெயின் ஹெல்த்துக்குமே வந்துட்டு தே பிளே அ மேஜர் இம்பார்ட்டன்ட் ரோல். ஸோ அந்த கட் பாக்டீரியா பேலன்ஸ்டா இருந்தாலே யூ வில் ஆக்சுவலி ஹாவ் அ வெரி குட் மென்டல் ஹெல்த் ஆஸ் வெல் ஆஸ் அ பிசிக்கல் ஹெல்த். So you should always include more of prebiotics and probiotics in your diet. So எப்பவுமே நீங்க சாப்பிடுற every meal plan it in such a way that it is well balanced. It has the essential carbohydrates, it has proteins, vitamins, minerals, fiber, and then it has the prebiotics and the probiotics. That is how you will have to plan your meal. Okay. And then aromatherapy techniques like lavender oil, chamomile oil and all, apart from the analgesic property, they also have this property of where they secrete dopamine. Dopamine is a good hormone for which acts as a mood enhancer. It's a happy hormone. Okay, so that releases dopamine. The moment you inhale lavender oil or there is a smell of lavender around you, automatically you tend to feel calm unconsciously. Like, without knowing, you'll just feel your body becoming very calm. Your nervous system will come down. Your BP levels will come down. It will just be a very calming effect when you are around a room diffused with lavender oil or chamomile oil. Okay. Yogic practices like Brahmari Pranayam, meditation, deep relaxation technique, yoga nidra, all these are specifically designed for physical and mental relaxation of the entire body. And hydrotherapy technique of steam bath, sauna bath, or hot food bath, these tends to remove the toxins from the body. The more you sweat, the more toxins come out. And once your toxins come out, your body tends to relax completely. There is no stress. The toxins tend to cause a lot of stress. So once the toxins come out, there is a good level of stress which has gone out. And so your body can relax completely. And again, exposure to sunlight is very, very important because of that component called as nitrous oxide. And the nitrous oxide, நம்மளோட physical body மட்டும் இல்லாம mental body is very important because vasodilation, நம்ம physical body மட்டும் நடக்கல, it happens to your brain also. So once the brain vessels also get dilated, there is good flow of blood. So on the good flow of blood இருக்கும்போது, the neurons, at the end of the neurons, you will have something called as neurotransmitters. Okay. So on the neurotransmitters release out when your blood flow is good. So once the neurotransmitters are released, that is when you will have the happy hormones getting secreted. Okay. So it is very essential for us to expose ourselves to sun. Okay. So with this, I I have come to the end of my presentation. For any naturopathic or yoga consultations, you can contact this number. But please, before starting any kind of diet or any kind of treatment, my sincere request would be please take in a full consultation, full proper consultation from a qualified naturopathy and yoga practitioner or a doctor, and then you can go in for your treatments. Yes. Thank you. Thank you for being so patient and listening to me. And I'm really sorry about my network issues. Thank you so much. Over to you, Preeti ma'am and Neha ma'am.
Namaste. Namaste all. So we have shared the feedback link, and if there are any specific questions that you are not comfortable asking here in a platform, we have a separate element in the form where you can ask those questions. So please fill in the feedback forms and the queries that you have, and we'll get back to you within 6 working days. Thank you. Preeti ma'am.
Thank you so much, ma'am.
Yes, I think because we have also exceeded our time, I think we can, because there is a way for the participants to ask it in the feedback form. I think we can close the session, ma'am.
Ma'am, I think there was one question. Yeah, please.
Yes, ma'am. I just saw a question in the chat box. Viparita Karani Asana can be practiced by persons having BP. Yes, you can, but to a specific amount of time. Yeah, because it depends again on everybody. It depends on the level of BP you have. It can be practiced, but not to a very high extent, not for a very longer period of time. But maybe for a very short period of time, yes, you can practice. Lakshmi ma'am, I hope I'm clear. But we will have to measure your BP levels, and then we can decide on the time limit of maintaining. Yeah, thank you.
Yes, thank you so much, everyone, for the patient listening. And thank you all for joining this webinar. And thanks to Neha ma'am and Amuda ma'am for the enlightening session. So namaste, everyone. Thank you so much.
Namaste, ma'am. Subrat.